So here's the thing. Hashimoto's, especially in the early stages of the condition, can cause intermittent bouts of hyperthyroidism. However, in between those bouts of hyperthyroidism, you're going to experience hypothyroid symptoms, and long term, it will eventually lead to chronic hypothyroidism. Hey guys, Dr. Brad here. Now you've probably heard the phrase Hashimoto's hypothyroidism so many times that you might think that those two terms have to go together, but that's not necessarily true. And in today's video, I wanted to talk about how Hashimoto's can cause hyper and hypothyroid symptoms. That way you can protect yourself as a patient, and also we can find strategies to get the best quality of life for you as possible. But before we get into it, if you like learning about natural ways that you can support your Hashimoto's and thyroid symptoms, please remember to like and subscribe. That way you can catch any of my new videos that I release every Thursday. Now I usually like to start off my videos by explaining mechanism first, but today we're going to do things in a little bit of a reverse order because I think this first part is so important. The number one reason why it's so important to understand that Hashimoto's can cause both hyper and hypothyroid symptoms is because if we don't get that, then when symptoms do occur, it can lead to us doing the wrong thing or choosing the wrong treatment. And while there's times in health where choosing the wrong thing might not be that big a deal, obviously not ideal, but we want to make sure we're doing the right thing for our body. In these scenarios, making the wrong choice can actually lead to some permanent outcomes that can be really detrimental for us. When someone presents with hyperthyroid symptoms, the first thought that most clinicians have is that this person might have Graves' disease. Graves' disease is autoimmune hyperthyroidism, where there is an immunoglobulin that stimulates our thyroid gland to make excess thyroid hormone. When we have too much thyroid hormone in our system, it ramps up our metabolism, and if we do that too much, it can have some negative implications for our heart, and it can make the situation life-threatening. Now, of course, that's bad, and in life-threatening situations, sometimes we have to take drastic action. So the choice is usually one of three things. Either people are provided with a medication that inhibits their TPO activity. If you recall, TPO is the enzyme that helps us to make thyroid hormone, and if we're making too much, by taking a medication that blocks that enzyme's function, we can then decrease the amount of thyroid hormone in our system, or we can be given radioactive iodine therapy. And since our thyroid is going to be the part of the body that has the highest uptake of iodine, if we combine that iodine with a radioactive molecule that will kill off parts of our tissue, administering this type of therapy will damage the tissue to the point where it can't make thyroid hormone. And finally, the last option is to do a partial or full thyroidectomy. If the gland isn't working, if it's making too much thyroid hormone, well, we can just take it out. Now, are there situations where radioactive iodine or thyroid removal might be appropriate? And the answer is yes. Graves can be very dangerous. Sometimes people will get such an enlargement of their thyroid gland that it can start to impinge on structures and tissues in that local area. And this isn't even mentioning the fact that some people have thyroid cancer in addition to some of these other things that are going on. And to help prevent the cancer from spreading, thyroid removal might be something that you want to have as part of your options and as part of the conversation. However, you might have noticed that some of these more extreme options are in response to some of these more extreme conditions. And as I've always said throughout all of my videos, we always want to make sure that our care plan or treatment matches the diagnosis that we're trying to address. Can radioactive iodine therapy or thyroid removal be a treatment option for Graves' disease? Well, if I had my druthers, it wouldn't be my first option because those treatments are non-reversible. And no matter what your doctor tells you, there's no medication that you can take that completely replaces the function of your gland. Your gland is dynamic. Medication is static, and your body is changing all the time. So we can't just pop out your thyroid gland, give you a medication, and say, yep, everything is going to be equal and the same. But what if the hyperthyroid symptoms aren't being caused by Graves' disease at all? What if they're actually being caused by Hashimoto's? So here's the thing. Hashimoto's, especially in the early stages of the condition, can cause intermittent bouts of hyperthyroidism. However, in between those bouts of hyperthyroidism, you're going to experience hypothyroid symptoms, and long term, it will eventually lead to chronic hypothyroidism. This is due to fluctuations in the way that the immune system is functioning, and again, we'll get to mechanism here in a little bit. But you need to know that not only can Hashimoto's cause fatigue, joint pain, brain fog, constipation, hair loss, dry skin, and weight gain, but it can also cause, in days to weeks or even a few months at a time, situations where you have anxiety, insomnia, increased sweating and jitteriness, sudden rapid weight loss, increase in heart rate, and heart palpitations. So what if you were to go into your doctor because you're anxious all the time and you're waking up in the middle of the night, sweating and with a heart that feels like it's pounding out of your chest? And then your doctor decides to get labs, rightfully so, during this same sort of scenario or episode. Well, those labs could be very suggestive and diagnostic for a hyperthyroid situation. But we have to ask ourselves, is that hyperthyroidism coming from something like Graves' disease, or is it due to a Hashimoto's flare-up? If it's Graves' disease, then we should consider all the Graves' disease treatments. But if it's Hashimoto's, then choosing a Graves' disease treatment could potentially make things much worse, and it could permanently change our thyroid gland, where not only are we dealing with a Hashimoto's issue long term, but now we have these medical interventions which are making things much more complicated. And this isn't theory. I've had patients who have had thyroid ablation or removal to help manage their hyperthyroid symptoms. But when we go back and we look at their labs, they don't have Graves' disease. They don't have a hot nodule or cancer. They were having hyperthyroid symptoms due to Hashimoto's, and because of a lack of understanding that Hashimoto's can cause both hyper and hypothyroid symptoms, they were given a treatment that wasn't appropriate for their condition. Now, the second big reason why we need to be aware of this Hashimoto's duality is because it has a big impact on your quality of life. If we're not aware that Hashimoto's can swing back and forth between hyper and hypo scenarios, then it can lead to us making decisions based on the moment rather than basing it on the big picture. So here's a little example or story for us to help illustrate this situation. Let's say in general, you tend to trend on the hypothyroid side of things. And when you go in to get your numbers checked, usually having a bit more medication and having your TSH be a little bit on the lower end is what tends to help you feel your best. But maybe recently there's been an uptick in stress at work and your sleep hasn't been good, and therefore that's messed with your diet a little bit. We've all been through those scenarios before. And the combination of those things has led to a flare-up in your immune system. Well, it's possible that this flare-up is bad enough where instead of making your hypothyroid symptoms worse, it's actually led to an intermittent bout of hyperthyroid. Well, it just so happens that your checkup is during this same week, of course, right? Everything happening at one time. And when you go in to get your blood drawn, your TSH is actually lower than it usually is, and it's actually below the lower end of the normal range. So what happens next? You know what the response is going to be. Your doctor is going to look at your TSH and go, holy smokes, your TSH is low. We've got way too much medication in the system. We need to back it off. So I'm going to reduce your dose. And while the general philosophy behind that makes sense, I mean, if we were to only look at the numbers, sure, we don't want to over-suppress TSH, but that doesn't make any sense in the grand scheme of things, especially based on what's been going on locally in your life and how you respond to medication in general. Thyroid function, especially with Hashimoto's, can be a bit of a moving target, and our labs are just a static, single snapshot of a moment in time. The problem is, if we ignore the big picture, we put on blinders and we only focus on that static marker, well, depending on how often you get your labs checked, You might have your medication dose reduced, but once your immune system calms down and things get back to your usual baseline, you might not have enough thyroid hormone for your system to function at its best. And depending on how often you get those labs checked, you could be feeling poorly for many months. So just because your TSH is high or low and you've previously been diagnosed with Hashimoto's doesn't mean that you've suddenly developed a new condition. It just means that you're going through the normal and typical fluctuations that come along with Hashimoto's. So sure, be dynamic in your response to new labs and new information, and have a conversation with your doctor about what the best choice might be. But we have to understand this overarching concept that Hashimoto's can change. Otherwise, decisions made in the moment might sacrifice long-term outcomes. So if you do go in and see your doctor and your labs are suggesting that you need to make a change, and you both decide that that change is warranted, well, if you're suddenly not feeling like yourself or you've noticed a decrease in function in the next few weeks, my recommendation would be proactive. Don't wait to get back in touch with them. Maybe your system has shifted once again, and getting new information, new labs, can be really helpful at avoiding, like I said, that many month downturn. What I say? Downturn, and make sure that we're working to keep you at a more stable and healthy place. So finally, what is the mechanism here, and what sort of labs should you look for to confirm that this flare-up of hyperthyroid symptoms is due to Hashimoto's? So our thyroid actually has a fair amount of thyroid hormone that is already made and ready for us on demand. And this thyroid hormone is stored in these little compartments called follicles. When we need thyroid hormone to be released, a follicle will move from the interior portion of our thyroid gland to the exterior portion. It'll bind to the outer part of the cell and then release that hormone into the bloodstream. Generally speaking, with Hashimoto's, we develop antibodies for specific enzymes and proteins that help us to make thyroid hormone. And that's why for a lot of people, when this process is impaired, it leads to this slow progression of hypothyroid symptoms that gets worse and worse over time. However, if there's a strong enough or severe enough flare-up of our immune system, what can happen is the damage that occurs to our thyroid gland can be so significant that not only are we impacting those enzymes and proteins, but the actual structure of our thyroid gland can be impacted as well. When this happens, those follicles that we talked about, which are just sitting around, hanging out, holding on to our thyroid hormone, they can be damaged as well. And instead of releasing thyroid hormone into the bloodstream in a controlled manner, suddenly we have the opening of all of these storage containers at the same time, and that can spill or flood excess thyroid hormone into our bloodstream, which is in much higher amounts than any of our cells actually need. And although T4 only has a half-life of about 4 to 6 days, these hyperthyroid flare-ups can actually go on for months if the immune system continues to be flared up and if it continues to actively damage our gland. But when we look at the labs, we will see positive TPO and or TG antibodies. T4 and T3 may be normal, they may be high, both are possible, and TSH will be mildly suppressed, meaning that if the normal range is 0.45 to 4.5 milli-international units per liter, it'll be closer to that 0.45 range or potentially around 0.1, 0.2, or 0.3, with some cases showing up slightly lower than that. However, this is going to look dramatically different than someone who has hyperthyroidism because of Graves'. Those people can also have positive TPO or TG antibodies, but their T4 and T3 will most likely be elevated. Their TSH will be significantly suppressed, oftentimes undetectable by the labs. That's where you'll see results that say less than 0.0001 or less than 0.005. So again, a big difference between less than 0.00. Did I get the right zeros right? Did I get the zeros right last time? 0.0001, 3 zeros, Big difference between that and 0.1. So that's the difference between a mildly suppressed TSH and a severely suppressed TSH. Plus, these people with Graves are going to have positive TSI or TSH receptor antibodies. Now, these markers are slightly different, but both of them indicate the autoimmune aspect that's associated with Graves specifically. So the information that I want you to take home from today is that not all hyperthyroid situations are severe conditions that require radioactive iodine or thyroid removal. And with Hashimoto's, it is possible to have intermittent bouts of hyperthyroidism in association with your hypothyroid symptoms. Now, not everyone is going to experience these hyperthyroid phases, but we do need to be aware of them, not only to protect ourselves from making the wrong decision, but also as we work with our doctor to help optimize our care plans and our medication. But if we do a good job of understanding how the disease works and how it progresses, and we're thorough with our assessment of our labs, then we can be proactive in the way that we're supporting you while making sure that we optimize your quality of life. But I hope that this information was helpful for you, and I hope it addressed a part of the Hashimoto's conversation that doesn't always get its due. Let me know if you've dealt with some of these issues and experienced confusion over some of your labs in the past. And if you have any questions, leave them for me in the comments as well. If you like the video, but you know that you're someone who's going to need more help and support, and would like someone to look at your health history, look at your labs, and create a clear plan for getting better, then you can send me an email at contact@seattlethyroidhelp.com, and my staff can help you to get set up for a free one-on-one consultation to see if we would be a good fit to work together. During these consultations, I'll ask you some questions about your health and figure out whether this is something that I can assist with or if we need to refer you to someone else. Of course, you can always ask any questions that you would like to get answered. We always want to make sure that you feel comfortable, you understand the process, and that you're in the right spot for you. If you're not ready for the consultation and would rather make some changes at home, then make sure to grab either one of my free downloads listed in the description box or check out any of the other videos on the channel. But that is it for this week's episode of Dr. Brad and his wacky thyroid hijinks. I love you guys. I hope you're doing well. If you have any questions, feel free to reach out. And if you're not doing so already, make sure to follow me on Instagram or Facebook for daily information and tips on ways that you can improve your thyroid symptoms. But I hope you guys are having a great week. Once again, my name is Dr. Brad Bodle, and I'll see you in the next one.